Afternoon, everybody. I think I may be the only surgeon, August gathering of physicians. Diabetic foot, India is almost near about 70 million diabetic patients, out of which 25% patient will develop a diabetic foot ulcer. And foot ulcer is the pivotal event which leads to the amputation. Amputation takes place in most of the cases into neuropathic foot. In India, near about 85% amputations take place in neuropathic foot. You maybe knowing causes. There are etiologies, maybe diabetic atheroscopy, diabetic neuropathy, vasculopathy, immunodysfunction, and joint instabilization and infection into the joint. We have developed a lot of preventive surgeries. I am doing a lot of preventive surgery in diabetic foot. Callus arthroplasty for IP joint, 65 cases I have done, maybe the second highest in India as such. There are other cases also. The physicians and general practitioners do not know about the preventive aspect of the diabetic foot surgeries. They know only amputation and debridement. No, there are many surgeries which can heal the ulcer completely, because healing of the ulcer is important. Not only healing of the ulcer, but prevention of the recurrence is that much more important. So you must go for not only healing but prevention of the ulcer. And to prevent in a diabetic patient is you can control blood sugar levels. Keeping the blood sugar level in normal limit in a diabetic patient who is not having the ulcer is the most, I can say, is a promising factor which can go for the long way to not going for the ulceration. Suppose the patient comes with ulceration now. Yeah, yeah, I'm restricting my time. I have no other this thing to say. So this is a fillet flap. Fillet means there is no bone. So you are using the tissue of the patient's wound and removing the bone completely, preventing the blood supply, and then applying to the patient's wound. That is the important. So this is the background for that. And you all know that laser toe fillet flaps. There are many people who are doing the laser toe fillet flap. Laser toe fillet flap means in the management of diabetic foot means when there is a infection, osteomyelitis, you do the amputations. No, you remove the bone, preserve the skin, and apply to the whatever the raw area is there, and you can help into healing of the wound. That is much faster way of doing the things. So in these cases, there are, you can see that osteomyelitis of the bone. Instead of removing all the toes, I have just preserved the skin and then applied on the raw area, and whatever is not possible, I have done the skin grafting, and you can see the end result. The patient has been healed together for a long time without any problem as such. And this patient was having the CKD and all these things, which has come back to the creatinine level come back to the almost normal. So many nephrologists are nowadays referring patient to me with a diabetic foot ulcers. Another patient, foul smelling ulcer, again osteomyelitis. I did the fillet flap of the small toe and wound healed within a no time. So small toe fillet flaps are there in the literature. There many are doing the fillet flap surgeries and healing the ulcer, but I have found that there are very few references to the grade 2 fillet flap. And I said, why not? If there is a osteomyelitis of the bone, if there is a loss of tissue of the grade toe, why not use the grade toe fillet flap and to cover the big wounds? So in the next case, you can see all the toes were gone because there was infection, and then the infection was spreading up to the great toe. I removed the bones of the great toe and used that fillet flap, removing the uh, nail, and then applied on the skin, on the raw area, and wound healed completely. And this patient is walking without any problem. Another patient, you can see that the wound, such a big fillet flap, and wound is healed completely. Another patient, this 65 2 years male, undergone having PVD also. Counts were on the higher side. They already undergone the 4 toes amputation, and there was ulcer develops. So I used that fillet flap of the great toe and help into covering of the wound. In both the cases, there was infection of the great toe and unsalvageable great toe. So almost we have to do the TMA amputation, and I have used the same skin of the great toe, so that the same skin is used, so that the healing is better. You can preserve the length of the foot, which is very important, and in that way it helps into managing the diabetic foot ulcers in this type of patients. Thank you so much.